Well, on behalf of the nationwide quality of care network communities of practice, point of care quality improvement, which is supported by WHO Southeast Asia Regional Office and a host of international development partners, I welcome you to this May International Session of the Communities of Practice. Well, as Ashna has already told you, this is the second of the country focus series on the Southeast Asia tour. It started from the month of March, and previously we've done the focus country of Bangladesh, and today we are we have immense gratitude to the team from Bhutan, which despite challenging pandemic conditions and very tight schedules has agreed to share their rich experience about the implementation of POCQI and the beautiful amalgamation of POCQI into the university curriculum, both at the medical teaching level and also at the level of the nursing fraternity into the nursing curriculum. And in the end of today's presentation, we are going to learn about a new aspect, and that is about the TQM, that is the total quality management, in which the aspects of quality assurance are integrated beautifully by Bhutan team with quality improvement. And they've got some phenomenal learning experience, which I'm sure all of you are going to benefit from this inter-country presentation. And before I sign off, between you and the speakers, I'm not going to be holding on for much long time. I would just like to build up the excitement by mentioning here that with the support of Dr. Rajesh Mehta and WHO CRO, the next month's focus country is going to be Maldives. So look forward to your email communications and the Community of Practice webpage, and try and enroll for the next session, which will be happening sometime next month. We will be announcing the dates, and learn from another partner country and be a part of all the Communities of Practice presentations by enrolling yourself on the nqcncop.org website. So I take pleasure in inviting our mentor and the man behind the whole movement of this Communities of Practice, Dr. Rajesh Mehta, Regional Advisor, WHO CRO. Dr. Rajesh Mehta, sir, the screen is all yours.
Thank you. Thank you, Dr. Vikram, for creating this opportunity. It's my pleasure to welcome everyone to the highlights from Bhutan on quality of care work for maternal, newborn, and child health. It's a pleasure to see people from several parts of the world. I particularly am impressed with Dr. Andrew Mikaka, who is the Director of Quality in Ministry of Health, Malawi in Africa. Welcome, Andrew. Long time. We haven't seen each other because of COVID. We also have eminent team from Bhutan, including Ministry of Health, to share with us the highlights of their institutionalized quality of care work which they have been doing. This has been also possible because my colleague in WHO Bhutan, Dr. Lobsang Dorji, and partners like Indra Chakma is there from UNICEF Bhutan. They have been working closely and supporting the and the university to expand this program of quality of care, which had started in the region in 2016-17, and Bhutan teams have been participating in the regional meetings, and we have also supported national TOTs in Bhutan like other countries. But Bhutan, we have seen a very methodical, systematic way of preparing a program for quality of care. And it is by choice that we all started from maternal, newborn, child health, as in Africa, so is in Asia, because we were more ready to take on this responsibility. While we fully know the quality of care is equally important to all healthcare areas. For example, now Karma Tenzin is in the Ministry of Health. He is not only responsible for reproductive health, but other programs, services also. Similarly for Andrew in Malawi, we using the same concepts and principles of quality of care in all healthcare areas very soon. So we also understand that there are several elements to quality of care program, and it's not one or two elements. The important elements include the regulation and legislation part, which normally comes from the national government level about how the healthcare should look like. It also includes setting standards, the standards of We are here as MNCH community, so standards of RMNCH work, and then also continuous measurement. Measurement whether the infrastructure is in place or not, leading to quality assurance and accreditation programs, and whether quality of care is also being implemented through continuous quality improvement processes, which ensures that whatever is agreed in the standards is actually amply implemented between the healthcare team and the patients at the point of care. So all of these elements are equally important. And if you focus only on one thing, QI or QA, or only regulation, or only standards, the holistic effect on care will not be possible, and the prevention of mortality will not be possible. So therefore, it's important that we hear today the experience from Bhutan, who have been trying to bring together at least the main elements QA and QI in their system with the leadership of Ministry of Health and a very able support from the National University on Medical Sciences. Both of the entities are represented today in the panel. So my request to everyone is to please note that there are two slides which will be presented, although they are doing a lot of other work. One is around bringing Q and QI together in form of a total quality management, which is also a well-known concept. And secondly, how to integrate or embed quality of care issues, specifically quality improvement in the education of health cadres. So you will see a lot of work being done with the nursing community, nursing profession, and a lot of work being done, including the QI part in the post-basic training of nurses in the university. Although we would want to see the same QI in the basic training also, both in nursing profession as well as in medical profession. And we are seeing good progress in including quality of care in MBBS and BSc nursing, for example, in other countries. So we continue to do the journey. So thanks once again for NQOCN to have arranged this, and Bhutan team, you are most welcome to kindly start the proceedings. Over to NQOCN to take us forward. Thank you.
Thank you so much, sir. For the first session, I would like to invite Mr. Karma Tenzin, sir, to speak about overview of POCQI in Bhutan by Ministry of Health, Bhutan. Over to you, sir.
Good afternoon to you all. Thank you, Dr. Ashna. Before I start my presentation, on behalf of the Ministry of Health and the team from Bhutan, I'd like to express a sincere gratitude to team NQOCN team for giving us this platform to basically share our experience of the implementation of POCQI in Bhutan, both at the university as well as at the ministry level. And I'd also like to take this opportunity to thank Dr. Rajesh Mehta and Professor Vikram Datta for guiding us throughout this whole process and giving us this opportunity to present to our member countries. So before I begin with my presentation, I'd like to going to my presentation. My presentation will basically focus on the point of care quality improvement towards improvement of quality of maternal and newborn health in Bhutan. So as I just want to supplement what Dr. Ashna during her introductory remark when she gave a brief introduction about Bhutan. So as you are well aware of the fact that Bhutan is a small Himalayan country located between China in the north and India in the south. And we have a total area of 36,394 square kilometer. And as per the latest population housing census of Bhutan, we have a population of around 735,000. And the governance is guided by the articulated in the Constitution of the Kingdom of Bhutan. And in the Constitution of the Kingdom Kingdom Bhutan, there's also a clause which mandates that the state shall provide free access to basic public health services in both modern medicine as well as traditional medicine. And also, as highlighted by Dr. Ashna, we also have a three-tiered health structure. That is, at the primary health center, we have at the primary level, we have primary health centers, and at the secondary level, we have the district or general hospital, and at the tertiary level, we also have the regional referral hospital and national referral hospital. So basically, that is the essence of our health system. And also, as explained by Dr. Ashna in her opening remark, we also have a free healthcare system, and also towards the point that also referral outside, especially to India and other countries, the government bears the cost of referring the patient outside. So in a nutshell, this is basically the Bhutan context, of giving you a brief background on Bhutan. And basically, this map will basically give you an idea of how the health system is spread around. So if you see that at the JDW NRH, which is the National Referral Hospital, and Wangdi Hospital, at the center we have Central Regional Referral Hospital, which also caters towards is a referring center for the central region. And we also have the Eastern Regional Referral Hospital, which acts as the Eastern Referral Center for the Eastern region. And all these other highlighted in blue are, we have a total of around 7 comprehensive emergency obstetric and newborn care center where the gynecologists are being placed. So these centers serves as the referring point, especially in terms of maternal and child maternal care. So now coming to the main presentation. Basically, how this concept of POCQI actually was introduced by the Reproductive Maternal and Child Health Program. So as you're aware of the fact that over the course of 6.5 decades, since the start of the 5-year development plan in 1961, Bhutan has always focused on the improvement and expansion of the coverage. And there's always been focused on the, like through the MDG, there's always focus on the expansion of coverage. But however, now gearing towards meeting the Sustainable Development Goal, the Royal Government of Bhutan, and in particular Ministry of Health, has realized that the health system needs to also focus and give emphasis on the improvement of quality. Therefore, recognizing this importance of improving quality of healthcare in Bhutan, Bhutanese health system, the Ministry of Health has come up with a quality assurance service division at the ministry, which basically is mandated to look after the overall quality aspects in Bhutan. And also at the hospital level, we have a quality assurance division which looks after the quality aspect. And in the government's 12 5-year plan, we have a major focus on coverage as well as on improving access to quality of healthcare to the people of Bhutan. And as you know that in the 12 5-year plan, a majority of the national key result area are related to components regarding reproductive maternal and child health care. So maternal and child health care plays a pivotal role and forms a major part of the national key results area in the 12-5 plan, and is also a central piece of the Sustainable Development Goal. So in the Sustainable Development Goal under the target 3.1, under good health and well-being, we also aspiring to have zero preventable maternal deaths. And quality and now just to briefly explain on some of the key initiatives carried out by the Reproductive Maternal and Child Health Program. As I mentioned earlier, because initially we were more concerned about expanding the coverage. However, in recent times and also in the 12 5-year plan, emphasis has been accorded to quality. So therefore, in order to bolster the quality improvement culture in the workplace, we have conducted several QI initiatives. So as just to give just to explain that the health ministry Ministry of Health introduced the point of quality care improvement in the maternal and child health services in 2017. So the Reproductive Maternal and Child Health Program was the first beneficiary under the Ministry of Health to implement this point of quality care improvement. And under this, we actually trained in 2017, master trainers were trained comprising of specialists like gynecologists, pediatricians from referral hospital, nurses, faculty members from the university. They were basically trained as and the objectives why we carried out this POCQI through the reproductive maternal child program was basically to develop capacity of health professionals on POCQI and also to facilitate the implementation of POCQI projects in our maternal and child mortality, because there's a big emphasis also in the 12-5-year plan to reduce the maternal as well as child mortality. And if you give a brief overview of some of the major indicators for the pertaining to reproductive maternal and child health program, we have currently, as you can see, the baseline for MMR is 89 per 100,000 live births. By the end of 12-5-year plan, we aspire to reach 83, reduced to 83 per 100,000 live births, and SDG target is set at 70 per 100,000 live births. For the neonatal mortality rate, we have 21 per 1,000 live births. By 12-5-year plan, we are expecting to reduce to 13.2. And for infant mortality rate, we have 15.1. By the end of 12-5-year plan, we are expecting to reduce to less than 15 per 1,000 live birth, and subsequently also similar to under 5 mortality rate as well as stillbirth rate. So this can only be achieved through the help of POCQI initiative of POCQI to further improve the quality, as well as which can help in further coming up with reducing those indicators. And just to give a few example of, we have several examples of QI initiatives in Bhutan, but just to give a few, some notable examples would be like, as I mentioned earlier, we have coached master trainers in 2017, like comprising of 15 health professionals, like specialists and nurses and from faculty from the university. Number two would be we have built capacity building of health professionals at the lower hospital level, and it will continue to go on. And we, through the initiative of POCQI, we are basically trying to bring out the emphasis that POCQI should be, to foster a sense of team building, and it shouldn't be as an individual project, but rather, it should be conducted and carried out as a team. And basically, one of the most notable achievement would be the incorporation of POCQI into the postgraduate curriculum in 2018. So some of the major, in addition to this, some of the major milestones in the implementation of POCQI project in Bhutan would definitely be that health professionals in Bhutan participated in regional meeting in POCQI, which is conducted by the WHO, CERO. And we also, as I mentioned earlier, we've trained the master trainers in 2017. We also conducted review of POCQI projects and conceptualization in 2018. And we also have had the opportunity to share Bhutan's experience in the regional webinars in 2018, and also for the Eastern region, we've also trained training of trainers in 2018. So these are some of the milestones that the Reproductive Maternal and Child Health Program has been able to achieve through the initiative of POCQI. And if you can just to supplement and give an idea of how this implementation of POCQI project has resulted in. So just to give some of the results. So after the implementation of POCQI, from Punaka Hospital team has found out that there's been an increase in the skin-to-skin contact for 90 million all normal deliveries of live newborn from 26.1 to 70%, which is a huge and significant increase over the course of 1 year. And if you can see from the NISU JDW Energy team has presented that the percentage of discharges before 11 a.m. increased from 38% in NICU and 20% in neonatal ward to more than 80%. So in both units, they've seen a significant progress after the implementation of POCQI projects. Then, from the Eastern Regional Referral Hospital team, they've also found out that there was an increase in completeness of partograph from 50% to more than 90% just within the span of 4 weeks. So which basically proves that the implementation of POCQI initiative has been quite successful, as is evident from the result. And finally, from Central Regional Hospital team also presented that there has been an increase in early initiation of breastfeeding from 32.1 to 86%. So which is quite inspiring, and to see that this initiative has yielded good results. And we have many more will come. So just to give a brief summary of some of the outcomes of POCQI project. So over 30 POCQI projects on various topics around reproductive, maternal, and neonatal health, newborn health have been completed in various hospitals in the country. 2 projects were presented at the regional level, which was hosted by WHO CERO for the member states. Interest to take this QI approach. So in recent times, through the support of WHO and as the university being the lead, we have come up with a blended learning module and total quality management, which will later be presented by Dr. Yuriko on a more extensive basis. And so some of the challenges that we are currently facing, we are well aware of the fact that the pandemic has actually limited us in the implementation of POCQIs, because initially we had the plan to expand the implementation of POCQI even at the primary health center, but however, due to the COVID-19, we were not able to expand and carry out and conduct the cascade training for our health workers on the primary health centers. Also, there's a problem of sustainability of POCQI initiatives, because it has to be reinforced again and again, because sometimes they just do it one time and they may not continue in the subsequent years. And training of health workers in POCQI has not been we were not able to carry out because of the COVID-19 pandemic, because there are certain restrictions in place, so we couldn't carry forward. But however, in future, after the restrictions are being lifted, we're hoping that we can continue with our training. And the other one, and the most notable one, would definitely be the lack of platform for implementing hospitals to showcase the experience. So such initiative, like as organized by NQCN, would give a good platform for implementing hospitals to showcase their experience at the regional as well as the national level. And the way forward would definitely be that the National Reproductive Maternal and Child Health Program would definitely continue to incorporate QI into our annual work plans and continue supporting the capacity building. And we'll encourage the formulation of multiple teams, even at the primary health centers. And the quality aspect will also be packaged with other reproductive maternal and child health initiatives such as EANC and KMC, which is also being currently carried out. And we'll also thinking that we'll draw an action plan on POCQI that will guide the program and hospitals implementing quality projects. And we are also hoping to institute mechanism of monitoring by identifying teams in the hospital, and create such platforms as organized by NICU and also at the national level for the implementing hospital to share their experience and also inspire other health professionals and health settings to promote quality culture. So these are some of the way forward, and this brings to end of my presentation. And thank you.
Dr. Yoriko will be talking about moving together towards total quality management for healthcare in Bhutan. So I would request Dr. Yoriko to go ahead with her presentation.
Okay, I will share my screen, okay?
Yeah, sure.
Am I audible?
Yes, we can hear you.
Okay. Thank you so much. First of all, gratitude for the organizer for giving us this opportunity. On behalf of the Total Quality Management in Healthcare Course Secretariat and the team, we are delighted to present about the moving together towards total quality management for healthcare in Bhutan. Before we start, we just would like to briefly orient where are we? The Kesalgap University of Medical Science of Bhutan, which is the only medical university in the country, located in capital city in Thimphu, and also 3 main referral hospitals in the country, our teaching hospital, including Jigme Dorji Wanchuk National Referral Hospital. And if we present about the progress of POCQI implementation in Bhutan, as already the previous speaker, Mr. Karma Tenzing, already mentioned, which actually started back in 2015 when Dr. Ashok Deorari, who is an AIMS professor, visited to Bhutan and introduced the concept of QI as a part of TOT for faculty-based newborn nursing organized by reproductive health program. And after that, the first QI project was conducted in the National Referral Hospital in Neonatal, conducted several training of trainer for POCQI using the regional training package, which was developed by CLO WHO office. And after that, in 2018, the QI was integrated into the postgraduate residency curriculum in Kesalgap University of Medical Science of Bhutan. So the QI project was included as a part of continuous assessment and allotted 5% of total marks for the degree requirement. And according to this curriculum revision, all current third-year residents are mandated to conduct a QI project in their respective workplace in their 7th semester, which start from this year, July. So after that, the several POCQI projects for a hospital, which is our teaching hospital. And also BSc Nursing and Specialized Nursing Certificate course started to implement QI projects.
I think we're facing some technical.
Key module is very well designed package, but we face several misconceptions in POCQI, which a majority of the use for the mother and newborn care, and not for the other disciplines. And also, since our nursing colleague ahead in implementing POCQI, so people often misunderstood that it's only for nurses and not for other category of health professionals. And also when it comes to the quality, that many people believe that that is only for the managers, and then the one who is in the front liner may not have much role, which is another misconceptions that we encounter. And felt that without knowing the standards and requirements and best practices, it is very difficult to identify the gap and problems that we notice while we are implementing this POCQI training package. So when we talk about the quality, we often talk initially to develop SOPs and guidelines, and we also may feel the competency-based education will improve the individual competency about the professionals. And also we often tend to initiate the monitoring and evaluation, clinical audit at the facility level will driving force. And both are true. And in fact, in the Ministry of Health, they made this Bhutan Health Service Quality Assurance Standard. And also we have some regulatory authority like Bhutan Medical and Health Council, just as similar to what NABH in India. But when it comes to bring the change in the workplace, that is very important to work as a team. So that is where this QI methodology have a very important role to play. And that this POCQI module is very helpful for us to build the capacity. Quality assurance and quality improvement has been implemented by the respective agencies separately, but we felt that that is very important to crossing the boundaries and connecting all the stakeholders for collaboration to bring these two together to make it as a total quality management. So as we explained that the Ministry of Health having this Bhutan Healthcare Standard for Quality Assurance BASH as a standard to be as a requirements to fulfill for all the healthcare providers. And this point of care quality improvement POCQI is a perfect pairs to match to build this total quality management in healthcare course, which contextualized to the Bhutanese context. So we have many interested parties as stakeholders in country, right from the WHO, Ministry of Health, JDW, NRH, and KGMSB. But we all working together towards the common goal to improve quality of healthcare in Bhutan for best health outcome. So to bring those stakeholders as a collective effort, that undergraduate medicine, Kesagapa University of Medical Science of Bhutan, Dr. Tashnizing, who is a neurosurgeon, also a quality management committee member in the JDW NRH, we built a team comprised by the stakeholders from GTW NRH, KGMSP, and the Ministry of Health. Bhutan Health Care Standard for Quality Assurance include a set of standards which the healthcare facilities needs to fulfill, at the same time having a lot of key performance indicators, and also having a guideline to how to develop key POCQI concepts to set the indicator and data-driven quality initiatives. And Sentinel event, this also can be a source of identifying the problem, which we can carry out quality improvement initiatives using the POCQI module. And also one of the standards is a quality, continuous quality improvement. So we align the POCQI module to the local context with creating generic case scenario and align to the BASH standards, created ready-to-use templates, toolkits, and review checklist, created virtual quizzes using gamification to engage learners and continuous virtual coaching platform. As we explained that the universal application of QI, starting from the personal development till the beyond the health services, but this TQM in healthcare course particularly focused on the point of care and also the facility performance, including the facility-based KPIs and benchmarking. And also we have a professional collaboration, inviting only the group participants with the multi-professions, encouraging multidisciplinary topics. And also we did this course as an experiential learning, developed proposal by the end of workshop, and mutual learning by the peers, and blended learning using digital pedagogy and blended learning flipped classroom model. So we achieved many SDGs, not only the health, but also the education by this. So the we conducted 3 batches of TOT, which the first batch we could do it face-to-face, but because of the amid of COVID-19 and increasing the cases, that we land up to do it, the 2 rest batches, full virtual. So these are the participants who attended. So multiple the clinic doctors, nurses, allied health professionals, and also the faculties from the university that participated in total 56 training of trainers, participants are included. So this is the outcome, that the knowledge assessment made the very good result, including almost all the participants fulfilled the pass mark of 80%. And also the participants felt that this course can be full online, and also can be done in 4 days. And we also receive a very good satisfaction level from these participants. So these are the QI topics of the 18 departments who attended to this training of trainers from the GTW NRH. And we also encourage to level up the QI careers, right, starting from participating in the QI project and lead and coach the QI project. And then subsequently, we would like to encourage them to publish their QI work, so that in that training module, we are including such component as well. So for the way forward, that after this TOT, that we will do the training for the residents, and residents will do the QI project as a curriculum requirement. Also, we are planning to scale up this training to the JDW and other healthcare providers, as well as the administrative staffs. And also we are planning to conduct the university faculties and staff dedicated to them using another standard like ISO and Bhutan Accreditation Council education standards. Last not but the least, that we are the team is doing the continuous quality improvement of the TQM in healthcare course itself, so that we are taking the feedback continuously and try to improve upon. And also we are planning to expand this training to the other teaching hospitals and beyond. And we are planning to create a common platform to share the QI works under the leadership of the Ministry of Health. And also we can think of training of COVID-19 plus QI. So the QI in the COVID-19 context dedicated for the infection control can also be planned. And last, the important component which we would like to add on once this total quality management concept is well captured by the many participants. So I acknowledge our teams and thank you so much for your attention.
Thank you so much, Dr. Yoriko, for that wonderful presentation. We can now have Ms. TQM with her presentation on integration of POCQI into university curriculum.
Madam is not assigned as host.
So Yoriko, TQM had written that there is some internet problem. So if we run the slides from here, can you read those slides and inform us what is happening? Maybe when she joins, she can start speaking.
No, she can present.
Oh, she's there. Okay.
Ashna, can you make her co-host, please?
Yes,
no, but TQM has written that she can present.
Yeah, definitely, sir. Just a moment.
Okay.
Assign Madam as host. She has 2 or 3 logins actually. So just check and just give us a moment. Please.
Yeah, no problem. So TQM, are you presenting yourself or you are asking Yoriko to present? How is your internet?
I will present.
I think Madam TQM would like to present herself. I think she's requesting the USN team could project her presentation.
Okay.
She can't share.
We will do that. Yeah. Sure.
We can do that. Yeah.
Very good.
I think Madam TQM just called me. I think she's also saying that her audio has also been put off. I think there's some technical.
Accounts are co-hosts, so ma'am can try.
Yeah, and then her audio is also off. She's like she can't put on her audio.
Ashna, can you request her to start the audio on that?
Done,
yeah. Just bear with us a moment.
I think I can. Can you hear me?
Yes, ma'am. Okay.
Okay, fine.
Yes, madam.
Yeah, but I cannot put on my the video.
It's okay, madam. They have shared the presentation.
Okay, so fine.
If you can see, yes.
Okay, so apology for the poor network. So as soon as I started sharing the slide, there was interruptions in the network, so I could not present it. So thank you so much for the nationwide quality of care network, Dr. Rajesh and Dr. Bikram for guiding us and providing an opportunity. And also would like to thank the Bhutan country office, WHO country office, for providing an opportunity for us. So I'll be presenting on the integration of POCQI into the university curriculum, that is particularly for nursing and midwifery. Can you change the slide? Next, please. And the inceptions of the quality improvement in the nursing and midwifery, that is particularly for the post basic nursing, the course was started in 2012. It was started. We start this quality improvement project at the final year of 2-year program. where we provide an opportunity for the nursing students to either work on the community nursing or use the leadership skills to improve the quality of nursing care. Either they can do that in the nursing or midwifery or in the community. Next slide, please. So what they do is they choose the topic of their own choice, depending on which they would like to improve, and they focus to bring the changes in nursing and midwifery care. So that is one-time learning as an academic mandate, and where not we didn't think of the sustainability, and it is within the time frame and no long-term goals being stated in the project. Next, please. So, however, there was benefit for the students. So, what benefits they usually get from this project is to help the students to advance their field, then to stay, to update, to offer the better patient care. Then they get lots of informations to provide more effectively to develop their own, conclusion on the evidence-based practices. Next slide, please. So with the inceptions of with the implementation of POCQI, that was in 2017, then we took a chance, as being in the nursing faculty of nursing and public health, we took a chance and we thought that would be the right time for us to change it, where we already have developed the study guide for the students initially when we started in 2012, which actually guides the students to work on their project. So in the unit 2, you can see in the table of content, which resolution is not very clear, we have included the project for quality improvement in their project. So where there's one unit where they have to work on this, depending on which topic they would like to. So next slide, please. What challenges that we face during the initial project was there was no standard the tools for us. So once it was started in 2017, with the help of Dr. Yuruko and the team, we started to provide the 2-day workshop for the in-service student, nursing student, where even the public health students attended that. So the challenge during that the workshop time we faced was the students were not able to relate the example or the exercise that was in the WHO standard, in the WHO framework, because it is basically it is on the mother and child health, and then students are finding it a little bit difficult to relate those examples and exercise where they were taking longer time to understand and try to apply those theory into the practice. Next slide, please. And in 2020, thereafter the workshop, then we have that time we had only 11 students, so they have come up with the certain topics for the POCQI. So there are 10 topics. Initiation of nursing round as surgical ward, improving nursing documentations using nursing process, improving discharge plan, enhancing discharge process, implementation of early warning, improving direct nursing task performance, then integration of the audit SPI in nursing practice. So nursing care improvement through depression screening, photograph documentation, and initiation of skin-to-skin contact. So if you see at the photo, that is the student who were trying to present to their own the project to wherever they have chosen the health facilities. So these are the topics that the students have chosen. So next, please. And with the permission from the students, so I have used the 2 slide. This is about the paragraph. So you can see that they have assessed the knowledge. They have assessed the knowledge of the paragraph, and then also they did both pre and post, so that comparison you can see on the pie chart, and they compare even the completeness of the paragraph, so pre-project and the post-project. So you can see the notifiable changes in the outcome, after when they compared with the pre-project. Next slide, please. So the way forward for us in being in the nursing institution is we want to integrate this concept of POCQI in the pre-service curriculum, where UNICEF country office was very generous enough for us to help that to integrate. So we will be providing the workshop, and then we'll see that how we will integrate that in the pre-service curriculum. So that will be in the nursing and also in the community health workers. And we also have integrated that the PDSA into the C4CD plus. So Care for Child Development Plus, we have just started with the help of in collaboration with Save the Children and MOH, funded by Lego Foundation. So that is C4CD concept. It's particularly reaching to the mothers, and we are health workers will provide the sessions to the mothers, particularly on the early stimulation. So we have introduced that the PDSA, but we haven't started implemented yet, but we have already developed the module at the sessions for the PDSA for the health workers. So they'll be working in the remote areas. So we would also, the way forward that we would also like to implement the QI in the education system, be it in the nursing, be it in the public health or community health or in the medical technology. So ultimate goal is to improve the quality of healthcare services through the improving the quality of education. Next slide, please. So this is the, if you see this in this slide, that we have integrated, why we have integrated or introduced the PDCA in the C4CD plus, it's there's a standard of the MOH for the benchmarking for the quality improvement of the health care services. So whatever we provide, try to improve the quality of healthcare services. There are standards that we have to keep that in mind in order to achieve that. So we have to have the tools in order to improve the quality. So achievement of the standards indicator and the target. So our in the care for child development, it's particularly it's helping the parents to provide the stimulation to the child. So certain things that we have integrated, it's also from the WHO framework for improving quality of healthcare for children. So we have used that the module from the WHO framework, and so that has not implemented, but been included in the module for Care for Child Development Plus. Next, please. I would like to share the experience from the students, that the challenges they have felt during implementing the POCQI project during their stay with us. So first, it's being a new concept. It's a time taking for the students to make the people understand. And next, there's a fear of the additional resources. So whenever we want to improve the quality, there's always fear that might need additional resources, huge additional resources. But it is not the only concept in the POCQI framework. So management support is very important. So it's very important for the team to convince the manager to get the support from the management in order to implement the project and also complete the project. And the committed of the team member, it's very much important as well, because as Karma and Dr. Hiruko said, that it is not by an individual team, it's needed in order to implement the project. And the one challenge that the students are facing is because of the short time frame. So because of that, they were not able to implement. So sometimes what happened, it's they do present, our students do present in between completing the project, and then once they graduate, so they complete the project thereafter once they graduate from our institute. And then we also have the challenge is inadequate mentor with the POCQI knowledge. So with uh, the help of WHO and in collaboration with KGMSB, spearheaded by Dr. Yuruko and her team. So she's trying to provide the POCQI, the knowledge and skills to the every faculty of KGMSP. So we are hoping that we will have a good team in the future to mentor the students. And of course, as Karma said, that there's no platform to showcase the work. So it will be also good for us that we would like to have the the platform for the students to, you know, put up their work, and then we can learn from each other all over the country or from the Sero region. Next, please. I think we're done. So that's all. Thank you so much. And if there's any questions, so I'll be happy to clarify.
Thank you so much for that presentation.
We'll take the questions subsequently, so requested to please type your questions in the chat box. Can we have the short video presentation from one of the nursing students sharing his perspective on the use of POCQI? Yeah.
Kudzangpola, my name is Seong Renzin, post basic nursing graduate of 2020 from Faculty of Nursing and Public Health under KGUMSP in Thimphu. Now I'm working as a nurse in one of the district hospitals in Bhutan. I and my colleague nursing students have attended a 3-day POCQI workshop during final semester of the program to carry out a project to improve quality of nursing and midwifery care. What I've learned from there is that the 4 steps of POCQI are very simple, doable, and effective, that any healthcare professional can use to reorganize patient care at our level to ensure good quality of care to the patients. The additional thing I have learned is it is a problem-solving approach within the local context in the health facilities by recognizing care within the existing resources, by identifying deficiencies in quality of care rather than faulty finding exercises. So I could apply this approach to look at the completeness of the pathograph at my hospital, and then I could timely intervene for the improvement of it. Therefore, I think POCQI model is a very practical based strategy to improve quality of care and solving practical problems in the hospital settings. Thank you.
So we also have Kile Wangmo with us, so she will join live to share her experience. Kile Wangmo. She's a current nursing student pursuing a pediatric intensive care in our faculty.
Hello.
Yes, we can hear you, Kile.
Good evening, La.
Good evening. Good evening.
Yes, ma'am, please go ahead. Welcome.
Good evening, sir. Currently, just now, I'm a member of short-term course. I have applied for pediatric ICU course to be an intensive nurse in FNPH, and I knew about this POCQI when I came to this unit, the ICU. I've been working here for the past 5 years, and I got my certificate on online workbook on 2017. So that time I didn't get much idea, but I got the certificate and I couldn't implement. But after this course, the course that I'm having at FNPH, I think I can implement my POCQI skills there, and with the help of my seniors here in the unit, I think I can bring improvements here. Am I audible to all now?
Yes, please go ahead, ma'am.
So just now we have started our POCQI. POCQI is in our 5th module. So we have just started and we're working on the topics here. And we are divided into 3 groups, especially in my unit sectors. There are 7 of us and we are divided into 3 groups. So we have chosen topics. So after this month, end of this month, I think we are going to go on with our POCQI projects. Anything that I can add?
So, Deki ma'am, you would like to add anything? I think excellent first-hand experience sharing. Thank you so much. Deki ma'am, would you like to add anything?
Okay, thank you, sir. So I can supplement Kile. So they're working on the project. So because of the time constraint, because of the interruptions in their work due to the pandemic, so they will be developing the project, so they may not be able to implement. So we have the mentor who is actually supervising them. So they have chosen the topic which is relevant in their own unit. So once they graduate, they will graduate in second week of August. Then they will implement that the project in their own unit. So they have chosen the topic which is very much the relevant to their own unit. And of course, we have, I think, Madam Karmacharin is there. She is the one who is actually guiding them. So thank you so much, sir.
Happy to see how much progress has been made in Bhutan with a strong support from ministry and the partners and the professionals, especially the doctors and nurses, who have taken POCQI approach as a part of total quality management for improving health services in the hospital. We all know that while we want to run health systems, quality improvement is one of the 6 or 7 pieces there. We also know that quality assurance in terms of manpower, equipment, supply chain has to be there. But in addition, it is so important for us to do measurement whenever we do quality improvement as a part of the process for improving health system. I'm not going to accountability and governance, which is going to be required, and the resources which have to be pumped in. But I am so happy to see that in the university and many of the hospitals, the young doctors and the nurses and midwives are getting interested in implementing quality improvement for improving patient care practices, for making sure that the best effective practices are implemented. Not as alone, as I learned from all of you, especially from the previous presentation, they are working as a team. They are working together. And then they are doing collaborative learning, sharing with each other so that the other people know what are the new things they can do and implement for improving healthcare practices. I am so happy to learn from the doctors and nurses that quality improvement methodology of POCQI 4-step approach is very easy to implement. It is a very common sense approach. And I know a lot of effort has gone in, and many of the participants from Bhutan have contributed in the whole development process of the POCQI module, the PowerPoint, the case studies, and we were able to even pilot test also in the country and create national trainers for quality improvement in Bhutan itself. So what I see is great gains which are happening. And I'm so happy to see that Bhutan is the first country, Rajesh, if I'm correct, that they are implementing this in pre-service education also. I know there may be challenges which are there. There will be a lot of learning which will happen. And the countries in the region should take it forward and get it implemented. We are still struggling in India to make this as a part of curriculum for Indian Nursing Council through nursing colleges in the country. But we know we have spread far and wide through Vikram and his network, and even AIMS, WHOCC, and through the Lakshya program, that many of the nurses and midwives already are doing quality improvement for the health system, for improving health services. The next thing which I would like to see from Bhutan is somehow sharing it on a wider platform, sharing it in the form of publications which can come out, so that more countries, more professionals, academicians are aware that there is a good work which is happening in Bhutan. And with that good work, others will get motivated to take it forward. So my best wishes are with you, and I am very sure India is a very close neighbor and a very good friend to Bhutan, and we would do anything which is required. And from WHOCC, being the head and in charge for WHOCC at AIMS, I may share with you that at this point of time, we have an e-learning package which is teaching healthcare professionals for COVID management of even adult patients, and how do you take protection for yourself, which is customized for the country. And we are using it for our doctors and nurses. And Rajesh, we would be very pleased from WHOCC to share that on a wider platform. And many of the things which are already created, there is no point in duplicating it. And majority of the material which comes is based on what the World Health Organization guidelines are for management of COVID in children and mothers and newborn babies, and how we have to take care of ourselves and do safe care, and also follow COVID appropriate behavior while we are taking care of patients in the hospital. So I'm so happy, Vikram, for giving me the opportunity to connect to all the friends in Bhutan, because I have visited them time and again, and I see with my own eyes how good work they are doing, and this work is going to be disseminated all across the CRO region, and many of the people from WHO headquarters also have joined, and they have listened to the presentation of what Yoriko and Deki and Ministry of Health people are doing in Bhutan. All the best. Good luck.
So